If it's okay, go into cow and show them kind of the imbalance of it. So just allow your pelvis to drop down. So she has a pretty healthy lumbar curve, right? That's not doing her so much good. So pull your belly in, elongate a little. Yeah, that's better to stay in neutral here. Then as she comes back, what she can do is pull the belly in, so take an inhale, and as you exhale, round and release back, and then pause there for a moment. See this rounding, does that feel good? Mm-hmm. So it's stretching what's kind of chronically contracted in her regular posture. Pretend I'm a flopper. I'm here, and I can just go foomp and drop my stomach to the floor. Picture it if you will, because it's not gonna happen. Suppose someone has that. Block the rotation of their pelvis. Have them do one side by bending the knee for however many breaths. Come out and then have them do the other side. So that's a way to limit how much. And age has got nothing to do with it. The woman in my training who had that going on, I think at the time was probably in her 70s, and she was still a flopper. Just because someone can go deeper doesn't mean they should. But if someone says, oh, I bulged a disc, it's, you know, if they've had an MRI, ask them which way is it bulging. And it's rarer to have bulging discs in the thoracic spine because of the rib cage and everything else, their lack of mobility. But if it's bulging forward, you're going to employ that critical thinking and say, okay, we're not going to go deeper into a back bend because that's pushing it more forward. Forward bends might get that to retract. Apanasana, that sort of thing. Is the pain across the back or does it manifest to one side? That can inform us that there might be a lumbar origin to the problem if the pain is up there. Or they might have a really tight low back that's giving them pain and they don't have true sciatica, they have it at the piriformis level. So you see how I'm just trying to let you know there is no aha, this is always the case. It's going to shift and turn. Do you get shooting or tingling pain down the leg or across the back? If it's across the back, they probably have some lumbar origin to their issue.